I want you to think of the effect that COVID has had on you. Not just physically, washing your hands an extra 18 times a day, but how has it affected your mind? Are you more bummed out? Are you thinking more negatively? Because this is what's happening to a lot of teenagers. I found something to contradict this in my art class. I realized that art can have a positive effect on our mental states, a reverse impact to COVID. Art therapy has the ability to resolve the mental effects of COVID-19. COVID has lessened our communication skills, brought more negativity, and led to an increasing amount of mental disorders. But art therapy can give teens a chance to express what's not easily voiced. It can evoke positive emotions, and the process can actually decrease depression. So, art therapy helps teenagers express emotions that are difficult for us to put into words, resolving the communication skills that COVID left lacking. COVID has drastically limited our opportunities to learn and practice communication. With school closures and activity cancellations, I saw this very clearly when we returned to in-person school last year, where classes that would normally be howling, yelling, and throwing miniature breakfast donuts were completely silent, and it became awkward to raise your hand or have a conversation with a classmate. This is exactly what Beth Marshall was talking about when she predicted that students would have setbacks in our social and emotional skills because of COVID. So how are we supposed to communicate our feelings if we can't verbally express them well? Art therapy helps us draw what we don't know how to say. This piece by an art therapy patient was published online by the American Art Therapy Association. The artist was described in a caption as feeling hopeless and lonely, and I think this picture depicts that without the artist having to struggle and fumble for words to try and explain what she doesn't understand. Not only does art therapy help us express our feelings, but it can actually help us change them. Art therapy can evoke positive emotions, combating the negative feelings surrounding COVID. I think we all have a negative connotation of anything having to do with COVID. Like, if I held this up, I might get eye rolls, anger, frustration. And that's not even to mention the negative media that's happening because of COVID. With so much of the news revolving around the pandemic, that means it's also revolving around death numbers, case numbers, illness, hospital beds, all of which is very saddening. Art therapy can evoke positive emotions to combat this by using elements of art and positive prompts. Art elements are things like shapes and lines, where a smooth curving line can promote calmness. And colors, like the London Image Institute describes orange as promoting enthusiasm and courage. Art prompts are things like this, listed by Shelley Clammer in her 100 art therapy exercises. The therapist would instruct the art patient to make a collage based on a quote they like. By encouraging them to think of and focus on something that they enjoy and brings them happiness, you're promoting a more positive mindset. Unfortunately, COVID has not just brought more constant negative emotion, it's brought a sharp increase of actual mental disorders. Art therapy has shown to decrease symptoms of depression, combating this rise in mental health disorders. This rise is clearly shown in a meta-analysis by Enracine and colleagues, where the symptoms of anxiety and depression were found to have doubled in youth globally due to COVID. And I think many of us won't be surprised by this, especially because depression and anxiety and other mental disorders are discussed more and more on teen social media. Art therapy can reduce symptoms of depression. In another study by Barcela and colleagues, chemotherapy patients took part in art therapy sessions. On the hospital anxiety and depression scale, they found that their depressive symptoms lessened the more sessions the patients took part in. I personally have experienced depression, and I go to talk therapy, which has helped decrease my symptoms of numbness by expressing my feelings. I imagine that if I weren't just confined to verbally expressing my feelings, but getting to also have the outlet of art as well, I think this numbness could decrease even further for me. In brief, the psychological effects of COVID are not unsolvable. Art therapy is a way to recover the expressive communication, the positive thinking, and the mental states we recently lost to COVID. So I challenge you to get online and find a professional art therapist or mental counselor's art prompt and try it for yourself. Do you think that art therapy could help you mentally recover from COVID? Do you think it could do the same for your peers, for your generation? Maybe this is a resolution to some of the mental effects of the pandemic that we need right now. Thank you.